The Gauteng Provincial Treasury has revealed that the health department in the province had to return almost 215 million rand to the provincial treasury, and this is due to failure to implement occupational health and safety infrastructure projects. While Gauteng Finance MEC Jacob Mamabolo did not mention it during his 2022-2023 medium-term budget policy statement last week, the information is contained in the department's adjusted estimates of provincial and revenue expenditure booklet. Now, the Democratic Alliance says it condemns the return of the funds which were meant to fix Gauteng's health infrastructure. The new Gauteng Health MEC, Nomantu Nkomo-Ralehoko, could not make it this morning. Unfortunately, the department says that it will confirm a date with us so that they can come and talk to us about this. But the DA Gauteng Health Shadow MEC, Jack Bloom, joins us virtually to talk about what they have found and what is going on in terms of the state of the Gauteng healthcare and budgets around that. Thanks so much for joining us here on Morning Live.
Good morning, good to be with you.
So, from what you understand, what is meant by the delays in the implementation of occupational health and safety infrastructure projects, leading to a surrender of 214.7 million rand to a provincial revenue fund, as the wording says?
Well, it's just complete incompetence to say that you're not spending this money because you can't generate purchase orders and slow processing of invoices. I mean, surely they've been doing this for years. It's a basic task. What distresses me is that, according to official figures, 19 out of 37 Gauteng public hospitals are not compliant with the Occupational Health and Safety Act. This means that they're basically unsafe, and it's a risk to patients and staff. And here we've got a large amount of money, 250 million rand, and it's just being sent back to Treasury because they couldn't spend it. I mean, we've seen this for years and years in the Gauteng Health Department. It's incompetence, it's corruption. It's got to stop. People are suffering in our hospitals, and to not spend money that's available, I think is just unbelievable, frankly, and there needs to be severe consequences for those responsible for it.
Yeah. So do we say that's what it's all basically down to, is pure incompetence? Is that your assessment of the whole thing? Is that when it comes to the management of the hospitals, the running of these hospitals, the upkeep in safety and infrastructure, the fact that we are returning money when these hospitals are in such a dire position is just pure incompetence?
Well, it has to be. When former Premier David Makura came into office 8 years ago, he pledged to an urgent, quote, turnaround of the Gauteng Health Department. Of course, that never happened. We've continued to have scandal after scandal, and I blame cadre deployment, quite frankly, because we don't have the best people running our hospitals. We don't have the best people in head office. And frankly, there is massive, massive corruption. We do know that Babita Deokaran was a very competent official in the Gauteng Health Department, and she blew the whistle on corruption and she got assassinated. So that's what happens to competent, honest officials in the Gauteng Health Department. And the Gauteng Health Department didn't even want to investigate this. It was only because journalists uncovered what was happening, particularly at the Tembisa Hospital, with hundreds of millions of rand just spent on fishy companies with goods that weren't even delivered, skinny jeans, we were told, expensive leather chairs. It just says to me that we don't have the people at the top of this department who can do what is necessary to fix our hospitals. And you can go to any of our hospitals and you can see what a poor state they're in. And now, a large number of them are actually unsafe. We've had several fires at Gauteng hospitals, so they're never properly investigated. We never get the reports at the end. And I think that it's just criminal, frankly, not to spend available money and make sure that our hospitals are all safe for staff and patients.
Yeah. In your communication, you mentioned that 19 of Gauteng's 37 public hospitals do not meet the requirements of the Occupational Health and Safety Act. So if we go back to 2019, former Health MEC Dr. Masuku admitted right here on Morning Live that all of the hospital facilities are not compliant with the Health and Safety Act. At the time, he committed that work on the infrastructure was to begin in a matter of a month from that time. From your
Well, I would.
observations, what changes have you seen in the last couple of years?
Well, it's up and down, but I don't see the progress that we should see. Yes, at one stage we were told that all our hospitals were non-compliant. I mean, that's an absolute scandal all by itself. Now we're told that 18 of them are compliant on a minimal basis. That means that they meet the minimum requirements of the Occupational Health and Safety Act, but that you need something like 8 billion rand to bring them up to, that they're decent standards of building. It's one thing to be minimally compliant, but if you go to our hospitals, you'll find that they're in a very poor state. So we have to rehabilitate all the Gauteng hospitals, actually. But of course, firstly, get them to be safe and fireproof as much as you can do these things. Fire prevention measures must be in place. But I just think that there isn't the expertise and the political will and frankly, the honesty to drive these projects to fix all our hospitals. They mustn't just be minimally compliant. They need to be pleasant places for both health and staff to work in.
And unfortunately, that's not the case. And I mean, this is the feedback that you do get not only from the patients that go there, but doctors speaking out as well, that unfortunately, our public health sector is certainly one where, the joy is taken out of it. And it's a major problem, because this is where people go for help. But the kind of things that you see within the public hospitals, I mean, what do you see? I know you're very vocal about this, and you've spoken on many occasions as to the kind of things that you find and the faults that we find. And I mean, when we talk about infrastructure projects, safety infrastructure and occupational health, and this is the biggest fault in our hospitals, and yet we failed to spend 215 million rand on fixing them. What are the kind of things that you've seen on investigations, Jack?
Well, there are a number of hospitals that are officially condemned. Tambo Memorial Hospital in the East Rand, the Yusuf Dadoo Hospital in Krugersdorp is also supposed to be rebuilt, and none of these projects are ever going to happen in the short term, because they say there isn't the budget for it. But here we've got 250 million rand. It's a substantial amount of money, specifically dedicated to fixing up our hospitals, and here it's returned to Treasury. So what I think needs to be done is there needs to be a radical overhaul of the Gauteng Health Department, also the Department of Infrastructure Development, which in many cases is the agent to fix our hospitals. Just put the right people in charge and spend the budget. Every year the Auditor General makes scathing observations. I think that his recommendations should be implemented and just do the basic things right. But to leave our hospitals in the condition that they're in and the suffering of patients and staff at their wits' end, trying to do what they can with the resources, and stop the thieving, stop all this, incompetence who are appointed in high places. Start with that, and then I think we can really begin to turn around the Gauteng public health sector, because, millions of people are dependent on it. They don't have any other choice.
Yeah. This has been going on for a very, very long time. I mean, in Gauteng hospitals, which authority or body is supposed to see the compliance, to oversee all of this, to account for the state of things, considering that there are about 28 million visits per annum in these facilities? Why are they not allowed? Why are they allowed to operate?
Well, look, I would look at the political accountability, frankly. There is a premier of the province. There are MECs of these departments. The Gauteng Health Department has had 8 MECs in the last 10 years. And about the same number of heads of department. And there's still a large number of acting people in posts. That's where the accountability lies. But we're still trying to convict corruption that occurred under former Health MEC Brian Schlonga 12 years ago. And we still haven't got that to court. Then there's the Life Esidimeni tragedy, and people haven't been prosecuted for that. I think it's just high time that we stop playing games. I mean, there must be consequences for people who don't do their jobs. There need to be criminal prosecutions for people who steal money. And we should look at what a health department is all about. It's about, healing sick people. What better higher purpose is there than that? And yet people just seem to think that health money is there to be stolen or frittered away or spent on overpriced goods. And competent health officials like Babita Deokaran are murdered. This can't go on. I'd really like to see the political will to fix this department once and for all so that we have a decent health service in Gauteng. It's an enormous budget. It's 60 billion rand. I think that if it was properly spent, I think we could do a lot better than we're doing at the moment.
Yeah, I mean, it really is such a it's such a shame that we've got so much money to put towards these hospitals, and yet when you walk through them, you see how absolutely under-resourced and just not looked after they are. I mean, the new Gauteng Health MEC, Nomantu Nkomo-Ralehoko, only came in last month. She was appointed by Panyaza Lesufi. Now, the new Gauteng MEC, of course, Ralehoko was the finance MEC before that. She now succeeds Nomathemba Mokheti, who was appointed after the removal of Dr. Bandile Masuku. So there's been a lot of shifting and changing all over the place, and none of them have really been in those positions for a long time. Could this be the reason for failed service delivery in a way?
Well, yes, I think all the shifting and changing, but, why don't we have, the right people in the job in the first place? So why do we have scandal after scandal? You see, that's why I think there needs to be sort of radical change. And, the head office is full of incompetence. There are some hospital CEOs who really shouldn't be there. I'll speak to one in particular, the CEO of the Rahima Musa Hospital. Dr. Tim de Meyer was a brave doctor who spoke out about the poor working conditions there and how patients were dying, and the CEO of Rahima Musa suspended him for pointing out what was going wrong. I think CEOs like that just need to be removed, and we need to have people who really do care about patients, who do care about spending public money responsibly and effectively, and get something going in this department so that it provides a service that people expect of it.
Just in terms of a closing argument, I mean, some say that the incumbent in these positions should be a doctor, someone who is familiar with the functioning of the sector. I mean, that goes for many positions within government, and that's an argument that many have been speaking about. To whatever sector somebody is in charge of, you should be somebody that is a professional in that sector. Others, however, say it will take an effective administrator. Masuku was a doctor. Was he effective, or is cadre deployment really the problem here?
Well, I think that department is so shot full with cadre deployments that that's where you've got to start. You've got people who should never have been appointed in the first place, whether they were doctors or not doctors. If you look at overseas health systems, you do have very effective administrators of hospitals who are not doctors. So I think we just got to have people who can do the job. And at the moment, we don't have people who could do the job in large measure. And the fact that 215 million rand, enormous sum of money, is just being returned to Treasury because they couldn't spend it, while our hospitals are literally crumbling before our eyes, as any visit to a hospital will attest, is just scandalous. So, I will keep pushing for decent health services in our province. But frankly, I think the change will only come when the ANC provincial government in Gauteng is booted out, because they've failed over all these years to fix up the system. And it's just because they put their buddies in office and they won't do anything about cutting out all the corruption and theft and incompetence.
All right, let's leave it there for this morning. Jack Bloom is the DA Gauteng Shadow Health MEC. Discussing the failure by the Gauteng Health Department to utilize funds meant for occupational health and safety infrastructure projects. A sum of almost 215 million rand had to be returned to the provincial treasury, despite the state of the dilapidation of the healthcare infrastructure in this province. We had invited the new Gauteng Health MEC, Nomantu Nkomo-Ralehoko. She couldn't make it this morning, unfortunately, but we have been promised that when she's available and able to make it, we will certainly have her in studio and have an interview to talk about this. So that's where we'll leave that conversation for now.